after the pray. That's why I'm a little bit late. Wait a second. Okay, Gm31. Good afternoon. Let's start our practices. So actually today we are going to talk about the general examination. I say to you to prepare for me general examinations. Okay, let's see. Let's see. So, how you know and do you remember of what consists of our general examinations? Everybody is here or who is absent today again? Wait a minute, I need to check your attendance. Okay, GM31. So this is our group leader, Muhammad Hamayun, right?
Yes, ma'am.
GM31, right?
Yes, ma'am.
Today is it your first class or not? Or this is your second class? Do you remember?
Ma'am, second class.
Second class, okay. Okay, let's see. Ali Bashir, absent or present? Everybody turn on your camera, please. And I need to know. Ali Bashir, absent or present? I think absent. Basit Muhammad Abdul, absent. Fahad Muhammad,
Present, ma'am.
present. Khan Sheraz, absent. Muhammad Hamayun, absent.
Yes.
Muzamil Muhammad,
Present, ma'am.
present. Salim Muskan, absent. Tariq Momina,
Present, ma'am.
okay. Zia Shah,
Present, ma'am.
present. Okay, now we can start our practices. So we're going talking about general examination. So your homework was the general examinations. So guys, tell me please. Yes,
Excuse me, ma'am.
yes.
Shiraz Khan, present.
Okay.
Okay, thank you.
Okay. So tell me please, what does mean general examination? Momina. Can you tell me please, what include general examinations and actually what does it mean? What about we are going to talk in our general examinations? How you
Ma'am, general examination, appearance, pallor, sinuses, in
Okay, yes, I am hear you. Keep going. Momina, I hear you. Keep going. You hear me?
Yes, ma'am.
You see the slide, right? What do you see in your slides?
Ma'am, physical exam.
Physical exam. So, Momina, let's see. Physical examinations divided into two parts. Okay. First of all,
Yes,
general
ma'am.
examinations. Then we do
First step is
physical specific examinations. Okay. You should guys understand this one.
yes.
Now we are going to talk about the general examinations at all. Okay. We are don't touch the systems. We are talking about the general examinations at all.
Okay.
Okay. So can you tell me please?
Okay.
Can you tell me please? Uh, so general inspections or general examinations consist of what? Consist of what? Can you tell me please? Here is this
Um,
slide. You can see.
Ma'am,
Yes, please.
yes. General condition of the patient, state of health, consciousness, position, physique, measurement of the body temperature, facial expression, assessment of condition of the skin, nails, hair, mucous membranes, subcutaneous fat, lymph nodes, muscles, bones, joints.
Okay. So you can see this is the like main points or main components. There is the consist our general inspections or general examinations or general survey. So the name is can be like that what I described to you. So Momina, can you tell me please what does it mean general condition of the patient or state of health? What does it mean, Momina?
Yes, ma'am. Ma'am, this state of health means the health of the patient uh, or the condition of the patient in which he comes to the doctor or its present state.
Arshad Ali, help. What does mean
Ma'am, it
general?
is a complete
Okay, okay,
physical,
Momina, I
mental
understand.
and social
You
well-being.
are right, but wait a minute. I want to check other students. Arshad Ali, tell me
Yes, ma'am.
please, what does it mean general condition of the patient or state of health? What does it mean?
Ma'am, your voice is not clear.
What does it mean state of health? What does it mean state of health? Ali, health,
Yes, ma'am.
health.
Ma'am, state of health is a figure of merit of condition of battery compared to vital conditions. Ma'am, actually it is normal metabolism of body and normal temperature of body, uh, and no disease, no pathogens.
Okay, so state of health, guys, actually, when you are checking the patient, uh, you check and only you see the first time these patients, and you can say this is the patients or ill or healthy, or this is the patients you can say feel well or feel not so well. So it's like something like state of health that is happening at that moment. But to give the full, скажем, if you want to give the full statement, if you want to give the full statement of state of the health, you can only say after checking the patient. For example, if it's the hospitalized patient, the patient lies in the hospital and you have, for example, for one patient, 10 days. So during the 10 days, you are observe the state of the health of the patient. Okay? It is something like that. Next one, I would like to know what is in consciousness. Muhammad Ali, I think. What does mean consciousness? Muzamil, help. What does mean consciousness? Muzamil, help. Guys, wake up. This is our second
Yes, ma'am.
practice and you cannot wake up. What does it mean, consciousness? How do you understand consciousness?
Consciousness include low blood sugar and low blood pressure.
No. Who can reply to me?
Ma'am, state of being aware and responsive to surroundings.
Can you repeat, please?
Ma'am, actually, consciousness is state of being aware and responsive of surroundings.
Try better. Try better. I'm not actually. I must begin. What are the important, right?
Ma'am, your voice is not coming.
I explain everything at the lecture, but you cannot understand anything. Why? Why? Can you tell me please why? Okay, here is level of the consciousness. Read this slide, Muzamil. Muzamil, read the slide.
Okay, ma'am. Is the patient awake, alert, and responsive to you and other in the environment? If not, remotely assess the level of consciousness.
Okay. So, Muzamil, what do you understand? So, what does mean consciousness?
It means patient alertive response against disease, environmental changes.
No, it means when you are sitting at your office, you are a doctor, the patient coming to you, patient coming by himself to you. What is his consciousness? Can you tell me, please, Muzamil? His consciousness clear, his consciousness normal. That's why he is coming by his foot and come to you, right?
Okay.
If this is the emergency situations and they take the patient without consciousness, then what you can say? His consciousness is abnormal. His consciousness is abnormal because he is not awake. He is not response to you. He cannot answer to your questions. You cannot take interview from him. Okay.
Yes, ma'am.
Okay. Let's read this slide and share us. Read this slide, please.
It's okay. Okay, ma'am. These lines, level techniques, patient response, alertness technique is speak to the patient in normal tone of voice. Patient response, the alert patient opens the eyes, look at you, and respond fully and appropriately to stimuli. Arousal intact. Lethargy, speak to the patient in a loud voice, for example, call the patient's name or ask, how are you? The patient appears drowsy, but open the eyes and look at you, respond to a question, and then falls asleep.
It means alertness. So
Yeah.
alertness level of the consciousness when you can what can patient do? Open the eyes. He can respond to you. Whereas in lethargy. See how to check lethargy. Shiraz, speak to the
Ma'am,
patient.
yes, ma'am, speak to the patient loudly. Ask his name or say, how are you? If his
Yes,
response is like when he opens his eye quickly and see at you. So,
yes.
and then
Then what
he
is happening at obtundation level? Obtundation level. What is happening in this
shake
level of consciousness?
foundation level, shake the patient gently, and if wakening a sleeper. So the response of the patient would be the attended patient open the eyes and look at you, but respond slowly and it's somewhat confused. Alertness and inert in the environment are decreased.
Okay. What does mean stupor? I wanna ask Muzamil. See, what does mean stupor? Or what does mean coma?
And stupor mean a painful stimulus, for example, tendon, rub the sternum or roll a pencil across a nail bed. No stronger stimuli needed. Coma mean apply repeated painful stimuli.
Okay.
Stupor the patient. Yes, ma'am.
What does mean coma?
Coma mean repeated painful stimuli.
Then,
Yes, no patient aroused from sleep only after painful stimuli, febrile response are slow or even absent. The patient lapses into an unresponsive state when stimuli ceases. There is minimal awareness of self or the environment. Mm, A comatose patient remains while with eyes closed. There is no evident response to inner need to external stimuli.
so see guys, unconsciousness patients, we call the patients in the coma. The patient is in the coma. This is the unconsciousness patient. In the Russian speaking country, we actually use the three levels: stupor, sopor, and coma. What does mean stupor? What does mean stupor? Muhammad, who is here? Muhammad Fahad. Can you tell me please, what does mean stupor?
Ma'am, it's the lack of critical mental function and a level of consciousness in which an affected person is almost entirely unresponsive and responds only to in stimuli such as pain.
Okay. What does mean sober? What does mean sober, Fahad? Fahad, Muhammad Fahad. What does mean sober? You hear me?
Yes, ma'am. It's abnormal deep sleep.
It's like a half coma. It's like a half coma. What does mean coma, Fahad?
Ma'am, in coma, a person is feeling the stimuli, but he's not responsive to the uh, stimuli which is given to him.
Okay, and it can be the reasons of the coma can be number one, alcoholic reason,
Yeah, ma'am.
apoplexy, hypoglycemia, diabetic, hepatic, epileptic. This is the reasons mostly can cause the coma. Okay, is it understandable for you?
Its state is long and uh, a man is unconscious in this state.
Okay, okay, thank you. Here is our actually numbness. Stupor actually translate into the English language like a numbness. There is no, if you see the patient's face, like there is no any emotions. This is the sopor. It's like a half sleep patients, but they can respond to you a little bit. And here is our coma when there is no any consciousness of this patient. So when you are put in your case history, you will put the consciousness is clear or normal or confused or abnormal. So you need to put in your case history. But you know what, guys? Uh, in the nervous system, neurological subject, you will study more better about the consciousness mechanism, how it appears, what it to do, and like this. Okay, the next point is about the position and posture. I have a question. Why you turn off your camera, or I need to put absent for everybody? Shiraz, can you tell me please what does mean position and posture of the patient? Position and posture of the patient.
Main position and posture of the patient mean a patient have body language and um, his gestures is how his gestures look, and
No,
also
no, no. Position of the patient. What does mean position of the patient? You
position
are
of the
at the hospital and you come to see your patient. In what positions of the patients you will see?
um, position of patient. Maybe he is lying on the stretcher, or
Maybe he's lying, maybe he's sitting, maybe others positions. But can you tell me, please, what kind of positions you will identify in the patient?
ma'am, it depend upon the patient um, that how he or she is looking. Um, so there are different position, normal
No,
position.
they have name. At the lecture, I give uh, properly definitions, properly, clearly aspects, components I give in the lecture. If you were at the lecture or if you loaded this lecture from the Moodle, you can answer me very, very easy. Muzamin,
Okay,
help.
ma'am.
Muzamin, wake up, help. Tell me please, what kind of positions,
Yes, ma'am.
excuse me, can you repeat loudly, please?
Ma'am, iteration
No, Muzamin, your internet is not so good. Fahad, try. Farhad, try. What are the positions? Muzamin, I cannot hear. Your internet is not so good. Okay, guys, I want to give to you 5 minutes break. Okay,
Okay, ma'am.
break. Come back. Come back. Turn on your camera, please. Okay, let's start. Let's keep going. So I hope you understand what does mean consciousness. So what does mean position? Here is, if you remember, I said to you, the patient's positions can be divided into three positions: active, passive, and compulsive. So read this slide. Sheraz, read this slide.
Okay, ma'am. Position and posture, it refers to the patient's body status and general way of holding the body. It divided into three: active position, passive, and compulsive position. Active position is the position the patient can move his or her body freely without any restrictions. It can be seen in normal adult patients with the mild diseases or at earlier stages of disease. Passive positions, the patient can't adjust or move his or her body. It occurs in extremely sick or patient with unconsciousness.
Okay, so you see, Shiraz, there is the like, if you reply to my answer or to my questions, your answer should to be properly. I need a properly exactly answer. So active
Okay, ma'am.
positions, when they're more, you come to your hospital and you see in your, for example, patient You come to the room to check the patient, and you see the patient is going normally, walking normally. So this is the active position.
Yes.
If you see the patient lies without any consciousness or coma or unconsciousness patients, it is the passive positions. They cannot do anything, sleeping positions, but we call passive positions. We have only three positions: active, passive, and compulsive. So I have a question. What is in compulsive position? Fahad. Momina, what does mean compulsive position?
Ma'am, in compulsive positions, we have compulsive spine positions, side down positions, and in compulsive spine position, the patient lie down on back with legs bending. And in
Okay.
compulsive side down position, the patient with the one-sided pleura.
Okay. Okay. So same your understanding. What does mean compulsive positions? How you understand? I need your understanding.
Uh,
I need your understanding.
okay, okay.
What? How you understand it? Momina, how you understand it?
Ma'am, ma'am, compulsive is the active position.
No. No. Active position is active position. Compulsive position is compulsive position. Compulsive cannot be active. Whereas mean compulsive positions. How you understand? Who understand and who can explain to me?
Ma'am, actually in compulsive position, the patient lie down on the back with two legs bending and
So why he is doing it? Can you explain me why he is doing it?
ma'am, actually due to abdominal pain
No,
or other pain.
why? No, why these patients decided to do this one?
Ma'am, actually uncomfortness in body.
For example, because he has disease and this disease give, for example, pain.
Yes,
And to decrease this pain, the patient looking for the positions that can make easy his state.
yes, ma'am.
Okay, that's why we call compulsive position. It's a forceful position. So patient force him to make a different positions. For example, what we have, for example, supine position. Supine position. Uh, the patient lie down on the back with two legs bended. For example, if he has the peritonitis is the inflammation of the peritoneum. So if he has the problem with the stomach, the patient will lie down, and we call supine position, compulsive supine position. You cannot saying something like lie down on the back. No, you are a medical person. You are going to become a doctor. So you should to say supine position, compulsive supine position. He do it to decrease his pain because it's really very painful diseases. For example, compulsive side down position. What does mean this position? Mm, uh, Momina, what does mean this position? How you understand it?
Ma'am, in this patient has pain, pleuritic pain, chest pain, a disease associated with lungs. Ma'am,
No, look at this patient. What he is doing? He is
He's
Side
trying to
down, he's side down. These patients looking to make a side down positions. Why? Why? For example, patient has pleurisy or pleural here. Why he is doing? For example, this is the problems of the lungs. You can see inflammation of pleura. And
Yes,
can you tell me, please, the patients will do side down in which part, in which side, left side
ma'am, both
or
sides.
right side? For example, your inflammations here is inflammations of the pleura. Here is. So patients do the side down position. In which position he will do? He
Ma'am,
will
on the
do in
source,
the unhealthy side down or at the healthy side down? How you think?
unhealthy side, sir.
Unhealthy side down. Why?
Ma'am, he's having pain there and he's trying to lie on the source side.
You think? Here is, look at this.
Yes,
The
ma'am.
patient can hug himself like this man, or these positions, when have the pleurisy. Why? They actually, the patients will lie down to the healthy side, to the healthy side. Can you explain me why? Why these patients will lie down to the healthy side? Who, what do you think? Who can explain? Guys,
Ma'am,
yes,
Yes,
ma'am,
ma'am.
I hear you.
actually patient will lie to the healthy side because uh, one side where is pain due to compression, pain may enhance. He want to
So
adjust his position onto the healthy side.
at the healthy side, actually, the patient will lie down because do you remember the pleural layers? It consists of two layers, parietal layer
Yes,
and
ma'am.
visceral
Great.
layer.
Yes,
So when the patients side down to the healthy side, this is the layers will not be close to each other, and the frictions will be not so much. Then if he will be not doing these positions due to the frictions of these layers, so the person will be side down to the healthy side. Okay, but if if there is the pneumonia, or if there is the lung abscess, so see, they are try to lie on a sore side. They are try to lie on the sore side or on the unhealthy side. Why? How do you think? Why? Can you tell me, please? Why? How do you think?
Ma'am, because of irritation of the sore side, that's why the patient may want to exert some pressure to relieve his
Okay.
pain.
So, first of all, for decreasing the pain, right?
Yeah.
Decreasing the pain, and to what? More better breathe, because the only one lungs is working. Healthy lungs is working. So he side down to the unhealthy, and healthy lungs start to work more better, helping to breathe him. Okay? Is it understandable for you? I hope, I think.
Yes,
yes.
ma'am.
Okay, let's see. One of the important positions, orthopnoea. Orthopnoea. What does it mean? Orthopnoea positions. What does it mean? How do you think? I need your understanding. Farhat, explain to me.
Yes, ma'am.
Explain to me, Farhad, what do you think?
Can you repeat? Yes, ma'am. About what?
Orthopnol position, orthopnol position. What does it mean? How do you understand this position? Guys, very simply, I need only your understanding, nothing more. I need only your understanding, nothing more. What does mean orthopnol? Guys, who can reply to me? What does mean orthopnol position? What does mean orthopnol position? Momina, can you try please?
Uh, yes, ma'am.
Can you try to explain to me what does mean orthopnol position?
Yes, ma'am. In this position,
Okay, Momina, read the slide. Read the slide.
an abnormal condition in which a person must keep the head elevated to breathe deeply or comfortably, or wakes up suddenly in the middle of night, short of breath. It can be seen in patients with lung or heart disease.
Okay, so you see at the picture orthopnol positions. So can you tell me please, guys, in which systems, in which diseases or systems can cause this position? How do you think? Can cause these positions? How do you think?
Ma'am, dyspnea.
So if there is the heart problem, if there is the
Lungs
what?
problem.
Lungs problem, respiratory problem, or cardiovascular problem. So in these two reasons can cause this position. You can see here is poor man, poor patient. He is sitting in the orthopnol position. We cannot say sitting position because we are a doctor. So we should to say orthopnol position. Read this slide, Fahad.
Yes, ma'am. Patient position orthopnea. It signifies advanced disease or incipient decomposition. Decompensation, lying flat increases venous return, and in patients with left ventricular impairment may precipitate pulmonary edema.
Okay, so you can see this is the patient sitting in the orthopnol positions because he has the problem with the heart. If he lies down, what is happening? Increases venous return to the heart and the patient breathe, cannot breathe. That's why he is seated. Actually, this is the position and this picture of this patient. You can see in the heart failure at the complications of diseases of the heart appears heart failure, and due to heart failure the patient cannot lie down, cannot, because he cannot breathe if he lie down. This is the heart problem. But we have the patients with the lungs problem also. Look at this. This is the patients with the heart problem. This is the patients with the lung problem, and they are in the orthopnol position. So can you tell me please, what is the difference? This is two patients, and why respiratory systems they will be in the orthopnol positions? Can you, Arshad Ali, explain to me?
What, ma'am? In which thing difference? Sorry, ma'am, I don't understand.
So no reply? Why? What happened? I'm sitting and waiting. Somebody replied to me.
Don't understand.
Okay. This is patient in the orthopnol position due to heart problem. You can see behind of the patient there is the two pillows. This is the patient with the respiratory system problem, with the lung problem, for example, bronchial asthma. So in the attack of bronchial asthma, they will fix their foot and hands to one positions and try to help to breathe. Look at his shoulder muscles. Look at this pectoral girdle muscles. He try with the pectoral girdle muscles, with the neck muscles, with the shoulder muscles. Try to take an area from outside. Look at this. Patients may choke or gasp for air, sit on the edge of the bed. It may be confused with asthma and open windows in an attempt to relieve their distress. So see, it is happened with the bronchial asthma patients for an example. But heart patients, there is the mechanisms is different. They're also in orthopnea, but the mechanism is different. Okay. Then also we have square down positions, rest positions, and also the like positions opistotonus. You will study in the childhood diseases. Here is our typical position of the COPD patient. Here is our respiratory system problems positions patient. Everybody again turn off camera and like whatever, right? And like whatever the teacher is talking. You know, guys, uh, actually these informations I know. I graduated my doctor's degree and everything else. This is information needs for you, not for me. Not for me, because I know all of these informations. But if
Okay,
you
ma'am.
want to know, you should to be a little bit active. But your group passive. So if the group is passive, it's very boring for me. I'm seriously saying to you. I cannot discuss anything with you because it's you don't study. You don't even open MacLeod's books. You don't even open my lectures. Everything is in the Moodle. When you can open it, read it, and try to understand. Actually, you also have an internet. You also have an internet, and also you can very easily research, it depends only on your wish. It depends only on your wish. If you want, you will do everything to understand. If you don't want, you will not do understand anything. So that's why, guys, I want to stop my practices right now because you don't want to study and I don't want to talk by myself all the time. If you want to study, if you want to study with me, so start. I really advise to you start to study the topics, start to do the homeworks. 30, 31 GM if you don't want to repeat this semester again, because I will not allow to you go to the next semester if you will not study my course. I can do it. We have the rights like that. So for today, this is the practices is done because there is nothing to do with you. You don't know anything. You cannot reply, and even you cannot explain, and even you don't want to listen. Disappears your cameras, turn off your cameras, and like do whatever I want to do. Okay, I will do whatever I want to
No,
do.
ma'am, we want to.
So that's why if you want
Ma'am,
study, I will to give you one more chance for the next practices. Prepare to me again general examinations, and at the Moodle there is the task number 3. You do the task number 3. General examinations, prepare again. I will ask to you. If the at the next practices you will not do this one, I'm be sure you will not allow to go to the next semester. Be sure. Bye everybody.